start with today's session. We'll be discussing with the possible questions and OSCEs from the section of Rhinology today. We'll also be having insight into if we get a nose case as a short case for our main practical, and we'll be touching upon CA maxilla also little bit, not in detail but little bit, so that how you can deal about with the case taking in this scenario. And apart from that, we'll be seeing all the important OSCEs which have previously been asked and which have the potential of being asked. Okay, so is my screen clear to you guys? Can I have a thumbs up from anybody? Thank you, Dr. Sir. Thank you so much. And hoping without less disturbance, let's start with today's session. Dr. Ashish is here. He had asked one question. Are you here, Dr. Ashish? Question पूछ के खुद ही गोल हो गया. Chalo, we'll leave this slide blank for Ashish now. Hi, Dr. Ashish.
Sir, good evening.
Hi, bhai, aa gaye? Chalo, long life. Was waiting for you only. So we'll start with the one small question asked by Dr. Ashish, and followed by that we will be moving ahead with the Rhinology section. Will take just 2 minutes. Okay. So guys, in our residency we are just told multiple things that like this article also you have to remember, this article also you have to remember. But please remember one thing. This is right. We all remember this question we had already learned for our practicals, right? The management of this type of N0 neck in CA oral cavity. So basically what had happened, De Cruz et al. This is a very famous article by Sir Dr. Anil De Cruz et al. And its colleagues. I have shared that article with you in the group. Go through that. This image is there in the Scott Brown also. Scott Brown में जो CA oral cavity का CA tongue का section है वहाँ पे, and they have already asked OSCE on this same thing. So what they had done, they had taken 500 patients and इनको they had divided into two parts. They had this is the 245 were the elective surgery group, and remaining 255 therapeutic surgery group. Means I'll just make the backdrop clear. Initially what used to happen in the cases of CA oral cavity, people used to go for wide local excision, that surgical removal of the tumor with a clean margin, and that was it. Agar lymph node positive hota tha, so then they used to go for neck dissection. In the patient in whom lymph node status were already positive, they were the candidates who used to undergo surgery. So as nowadays concept is there कि CA oral cavity में elective neck dissection will be there. This concept is there that in the cases of CA oral cavity, neck dissection will be done. In the earlier part, it was not there. So what Dr. De Cruz sir did, he took data of 500 patients and he divided into two parts. One was the elective surgery part, means in the cases of CA oral cavity, he did surgery, that is the WLE plus neck dissection side by side. In the same setting, he did it. Whereas in the second group, what was done? That what was done was people underwent WLE, that is the surgery was done, and followed by that, people were kept under observation. They were regularly observed and assessed for any positive changes in the lymph node. Okay, and then they used to undergo surgery for lymph node, that is neck dissection. So what was found that this group, ये वाला जो group है, I'll just make it this group. So basically what was found, that this group in which elective surgery, that is elective neck dissection was done along with surgery without waiting for the lymph nodes to become positive, this group had better survival, or in other words, lesser mortality. So therefore this experiment was stopped in between only, and this was taken as a mandate that there will be elective neck dissection done along with elective surgery in the cases of CA oral cavity, not depending on whether it is lymph node status is positive or not. Okay. So, and over here only you will find a very, how will you have a very favorite question that will be asked to you, that is by the name of Kaplan-Meier curve. So today, revise this free oral cavity, the same section of management. Just see the same curve in which they have shown the trend of how this survivability was better in this first wala group. Okay, so this is regarding the question that was asked. Please read it once again. If again still you have problem, please let me know again. Okay. Chalo, let's start with today's session now. Okay, so guys, let's come to the one of the question which has been repeated twice till now and might be repeated in your OSCE also. What is the name of this honey? Can somebody answer?
Manuka honey.
Manuka honey.
Yeah, this is I'll say an easier part of question for you guys. Okay. Second, what is the active ingredient in it?
Methyl glycol.
Methyl glycol, right? Third, what is the organism they are asking? So organism, if you don't remember the exact answer in ENT, you can write Pseudomonas. Okay, most of the time you will be correct. Yes. Then it, apart from Pseudomonas, it is MRSA, it is MSSA. Okay. And from which country is it brought?
New Zealand.
New Zealand. Okay. Great. This is New Zealand. Okay. And they are asking that the active EA is Leptospermum spiraeum over here. Okay. Indications we remember. Okay. So this is another photo from Scott Brown which they had taken in the main exam and asked you. All the details that we just wrote are from this para of Scott Brown. Okay. So please remember it. This is important. Okay. Start question hai. If it comes, it should not go wrong. Okay. So here only, since many people have joined late, okay, I'll just take a minute and guide you how to go about it. See, we'll be having 20 OSCEs, okay, of 5 marks each, resulting to your 100 marks. And you'll be getting 4 minutes for one OSCE. Okay. The problem with the OSCE is that the timer starts over here as soon as you start answering. कि आपको जो 4 minutes मिल रहे हैं, it will start from 3:59. So by the time you have read your question, already it will be down to 3 minutes, 2 minutes. So there is the panic. Now 2 things that you have to remember. Anyone else is trying to log in? No. That first thing is कि every OSCE, it will be having 2-3 parts and all parts will be having marks. Okay. So if you write too much in this one, that trying ki I'll write too much and I'll get more marks, doctor, you will get only the marks which are designed for that question. Okay. So one advice is ki answer every part. Don't leave anything blank, because if you leave blank, that will be unassessed and that will be a nonsense being done from our part. One. Second thing is there is no negative part. Okay? So don't leave anything blank. Whatever you read that question 2-3 number of times, 4-3 number of times, it's possible. What if you don't get anything? Just think wherever you have heard that thing, seen something related to that during your residency days. Write that thing. खाली नहीं छोड़ना है. You don't have to leave that question empty. Okay. Now, second very important thing is after, like, you will be given 20 sheets. Sheet number 1, sheet number 2. ऐसे करके 20 sheets will be given. After the completion of your 4 minutes, this sheet will be taken back by the examiner. Okay. So please make sure you have written your name, roll number, and question number of that whatever you are answering. उसके अलावा then you write the answer. You would have written all thing correct. Roll number if you have given wrong, भूल जाना, number नहीं मिलेगा, है ना? I just got like after the results came, same mistake was done by 2 candidates in our batch only. That in question number 5, written question answer number 6 in place of question number 6, written answer number 5. 20 numbers gone straight away. Nobody will assess also. People are like that, है ना? So please don't make these type of mistakes. Whatever you have, and this question sheet will not be provided to you back. एक बार गया तो गया, वो वापस नहीं देंगे. So whatever you want to write, because this was the thought process which I also had when I was giving my exam. Ki, okay, I'll remember it and I'll answer it back. No, there's no back over here. Whatever you want to write it in those 4 minutes and hand it over to the examiner. And over these 20 OSCEs, don't bang your head too much into all the difficult topics. 10 OSCEs will be like simple. Simple matlab, if you would have worked entire 3 years in your ward and all, you will be knowing something around that. 5 questions I'll say, this will be like if you have studied some OSCEs, some probable questions, any book, any notes, this you will get over here. Okay, so till this 15 question I'll be able to help you out. If you will read whatever things have been shared in the last 1.5 months, ये 15 questions आपके निकल जाएंगे. Remaining 5 questions, this will be bouncer. Anything can be asked. Anything means literally anything. So don't bang your head for these 5 questions. We need 100 marks का OSCE है. So we need around 50 plus marks should be here, should be coming from this section to pass easily. तो आराम से मिल जाएंगे यहाँ से. ठीक है? So don't worry. Like supposedly, and these OSCEs are in a set. Supposedly, if you are in a like unlucky mood, initial 5 questions come off this way कि आपको कुछ नहीं आता है. ठीक है? So don't get panicked. Don't get panicked. You will fail in the next part. This happened. The same thing happened with me when I gave my OSCE session. Initial 10 OSCEs were absolutely correct. I was like, if I was like 10 into 5, 50 marks to मेरा straight आ गया. But remaining 10 questions, I was like struggling even to remember a single word about it. Okay, so this happens with everybody. Nothing to worry about it. Focus on the case presentation part. 100 marks over here. 100 marks will be there for your case presentation. It depends upon the schedule over there. Like they have told 50 marks के 2 case होंगे. Sometimes they divide it in between also. So this is the place where you have to score at least 60 plus. At least. ठीक है? And this is very easily scored. Very easily. So please, जो long cases that we have decided, please go through it. Sioms Commerce is your bread and butter. You cannot think of passing without answering the basic questions of Sioms Commerce. Okay, so put your basic efforts into Sioms Commerce. If you will get this question in exam, 90% of you will get Sioms Commerce. It should not happen कि ये गलत हो रहा है. ठीक है, चलो coming back to our section. This is one of the previously asked question that they have given you this section. Please go through the NCCT PNS videos. ठीक है, from wherever you have studied, either that or Dr. Sandesh sir के videos I have shared with you guys. उनका देखना है and all the named cells should be remembered by you. This is apart from the named cell, this is the important section. So let's see what is the red arrow. The red arrow is the optic nerve. Since this is the start section, I'll not just bore you too much. That is the optic nerve. Yellow is the foramen rotundum. ठीक है, and green is the median nerve. ठीक है, over here you have to read the star mark is the asterisk mark is the lateral recess. ठीक है, over here please some things I am writing for you to read. This is your Sternberg canal. ठीक है, Delano's classification. ठीक है, Hero's classification and Kennedy's nipple वाला जो part है. All these things are very highly likely to be asked potential OSCEs. Okay, so moving ahead. So guys, if supposedly we get a nose case, I'll just take 5 minutes and we'll see through what all things we have to ask in nose case. You will generally get it as a short case, even if it's coming. It can be either AFRS, CRS with polyp, it can even be IP, it can even be GNA, depending upon what kind of cases are kept in your exam. Or it can be even the CA maxilla part. So generally how you have to go, you have to go about the occupation. The whole PDF I have shared, I'll share it again also. The scheme of examination, either you can follow whatever has been taught in your institution or you can follow this one. Okay, so over here 2 questions will be asked. Generally males or the wood industry जो है, this is IP. Okay, then whatever the symptoms are there, that is the nasal obstructions of, these are the cardinal symptoms. Okay, so you have to tell whether it is insidious, progressive, plus minus facial pain है कि नहीं है, plus minus aggravating और रिलीविंग फैक्टर, ठीक है। देन द नेजल डिस्चार्ज, टू थिंग्स, फाउल स्मेलिंग है और ब्लड स्टेन, ठीक है। एंड थर्ड सिम्टम विल बी एपिस्टैक्सिस, ठीक है। ओवर हियर दिस हैज हाई पॉसिबिलिटी बिकॉज इससे आपका वाइवा विल गो इनटू हेवायर डायरेक्शन, ओके। सो व्हाट ऑल यू हैव टू सी ओवर हियर, नॉट मच। So basically we have symptoms के लिए आपका क्या क्या होगा, nasal symptom can be there, oral symptoms can be there depending upon what kind of extension and what kind of involvement is there, then orbital symptoms can be there, facial symptoms can be there, and last में in severe cases neurological symptoms can be there. So nasal symptom में क्या होगा, अभी पीछे पड़ा, nasal obstruction होगा, nasal discharge will be there, epistaxis will be there, smell loss will be there, okay. Oral symptoms में what can be there, if in severe cases mouth opening can be affected, trismus can come, remember the grading of trismus, and there is a osci of screw which is being put into mouth, that is trismus relieving device, okay, please read it. Then there any history of dental or loose tooth, ठीक है, any history of snoring. Orbital में it's easy, it is diplopia, okay, or it can be epiphora or swelling around the eyes, okay. Facial में okay, membrane like numbness over the face or pain is there or not, okay. And so coming to the staging, so 4 grades, right. First में only history is suggestive of sinusitis, इसमें क्या होगा, above plus bony erosion, above plus neurological deficit, and this above plus distendments, okay. Wherever you are taking the case, always write the whole scheduled format as you have already read for your exam. My motto or like what I'll suggest to you guys is play safe in your exam. Don't be like कि नहीं इसमें तो पूछते नहीं है, I'll not write it. Please, if you have time, if you don't have time, it's another thing. But if you have time, please make out something, and whatever case sheet you are having, please mention these details in a legible writing, okay. If you get an ear case, draw that diagram of tympanic membrane, draw that diagram of cholesteatoma oblique attic retraction, whatever you are writing, because many a times it happens the examiner might take your case sheet ki, अच्छा case sheet मुझे दे दो, अब बताना शुरू करो, and if you have just scribbled something over the case sheet, it does not give a very good impression over the examiner, and he is like, yeah, it's his number वगैरह, he will not give that much marks, okay. So coming ahead, you will write the presenting complaints, you will write the HOPI already seen, you will write the any past history is there, any treatment history is there, routine that we see. And how to go about saying examination part. On examination, whenever you are examining the nose, mention about external nose, mention about what if any swelling is visible on inspection. So you have to mention like 2 by 2 centimeter or 1 by 1 centimeter swelling is visible on left side of nostril, if visible. Not visible, no need to say that anything is visible. Similarly, you have to palpate it. Then you have to mention about what all parts are there that you have to mention. External nose we have already seen. Okay. Then you have to speak upon contour, whether it is deviated or not, how is the root and the bridge, supratip, columella, and then after you say ki sir on lifting the tip of the nose, we go for anterior rhinoscopy. Something is visible, you have to mention, and what you have to mention, I'll just take the next slide, that supposedly you see some mass in the nasal cavity. I'm not speaking about CA maxilla, anything can be there, okay. It can even be a polyp, okay. So you have to mention ki sir like this is visible in the so and so nostril, okay. Then हाँ जी, then pass the probe. इससे क्या, what you will come to know? You will come to know the attachment from where it is arising. Okay, whether it is bleeding on touch or not. These are important sections over here. And then posterior rhinoscopy. Please carry your idea. So just try to use it. Whether the findings are accurate or not, that is another thing. But please use it. Okay. And these both are independent questions in itself. How to use a posterior rhinoscopy mirror, how to use a ideal mirror. Okay. Don't get confused in both of them. It is important. Please carry them along with you. Okay. And second more thing is, this is an independent OSCE or independent question which can come. What is the diagram? What of structures that you see after posterior rhinoscopy? ठीक है. So remember that जो आपका ये diagram है ना, जिसमें आपका ये आप adenoids भी बनाएंगे, tonsils, base of tongue भी बनाएंगे, ठीक है, eustachian tube भी बनाएंगे. So that diagram, practice it once or twice, ना, how to give in the exam. Okay, and in the nose case, please examine the ear for presence of OME or not. है ना? That is an important thing. Okay, and in the another findings में आपका क्या आ जाएगा? Spatula test आ जाएगा, cold spatula test. ठीक है. Cottle's test आ जाएगा. Modified Cottle's आ जाएगा. All these are your possible viva question. ठीक है. I'll share a PDF. Nose case, please read it from that. Else, if you are reading any book from your side, Neha Shah is a good one. Like if you guys are reading it, so just go through the same thing. It's important. Okay, so whenever this nose case will come, so it is like it will ask you this question. What are the DD of nasal obstruction? This is a very common question which is being asked. So directly don't jump. Is a DD of nasal obstruction, rhinosporidiosis, CRS, AFRS, inverted papilloma? No, I'll not suggest answering in this way. Always answer by breaking it out in various sections. You can either answer, sir, जैसे हम लोगों ने starting से UG days से we have read कि sir congenital में so and so causes are there, traumatic के so and so causes are there, infection something like that, inflammation, tumor something like that. Okay, or you can answer in, sir, these are the causes for unilateral nasal obstruction, these are the causes for bilateral nasal obstruction. So what are the causes? Congenital में क्या क्या हो सकता है? Anyone?
Nasal glioma.
Trachea.
Choanal any glioma, encephalocele, something like that can come. ठीक है. Choanal atresia is an important question for your OSCEs. Choanal atresia में कौन सा nipple, which nipple do we use for the baby?
McGovern's nipple.
McGovern's nipple. ठीक है. Remember this image. ठीक है. And traumatic, it can be like a traumatic DNS can cause all these things. Okay. And then in infective causes में you can either have both the RRR, that is rhinosporidiosis, or the rhinoscleroma. Abhi we'll see both of them in a while. Okay. Over here, two important things are there. HP is important. ठीक है. Apart from HP, Russell body and Mikulicz cells are important. I'll share this PDF with you guys. You can edit it and add information more as per your need. Okay. Now, inflammatory mein you'll be having CRS, you can have AFRS, okay, and multiple other things. Tumor mein you can divide it benign and malignant. Okay, so you'll be having GNA, inverted papilloma, and then will be malignancy, obviously adenocarcinoma. Okay, we'll see GNA and IP both in details. Okay, let's move ahead. I'll not waste time over here. So let's see the important things about rhinosporidiosis in a single slide. Okay, so iska HP yaad rakhna. See how these sporangias are bursting from here. Okay, they're bursting from here and they're coming out. Okay, so there will be multiple HP images that will trouble you till your exam. Okay, remember the important ones. That's only I can say. There is no shortcut. There is no trick कि इसको ऐसे याद कर सकते. Probably I don't know these things. If you have, please share with everyone. Okay, else important things where you remember the HP images. So basically you know that this is caused due to Rhinosporidia sebri, which is a mesomycetozoa. Okay? And where all it can cause symptoms, it can cause problem in your ocular region. It can be seen in the conjunctiva, lips, palate, maxilla, and even larynx also. Over here, they might ask you what is the medical management of rhinosporidiosis. Anyone?
Dapsone.
Dapsone. Okay. So that should suffice for rhinosporidiosis. No theory much more than this. Rhinoscleroma. Remember this image of this gentleman or gentlewoman. Okay. Two more names over here. This is called as wooden nose, tapir, or hebra nose. These are the names. Hebra nose. Okay. These are the stages. Catarrhal stage, granulomator stage, and then fibrotic stages. So remember the stage for this thing. Remember the HPE for it. HP mein there are two named cells over here, Maculis cells and Russell bodies. Please remember it. And this is caused by which organism? That is Klebsiella rhinoscleromatis. ठीक है, which is a gram negative bacteria. ठीक है, I don't think इससे ज्यादा कुछ पूछेंगे, but revise these things multiple number of times. वहां पे प्रेशर में don't make mistake कि causative organism गलत लिख दिया तो 1 marks will be lost. Okay, so these are the possible. I don't think इसके अलावा there is any other possible questions from rhinoscleroma that can be asked. Okay, so revise these things side by side and remember it till your exam. So these are the causes for unilateral and bilateral nasal obstruction that we thought will be coming. Okay, so coming over here, there are multiple short forms waiting for you. In your exam, you will be getting 2 short forms writing for enhance full form. In my exam, I got full form for CBNAT and area. दोनों किए थे. CBNAT I was able to answer. Area I made mistake. Multiple number of times I like Viva में we had answer area guideline. But जब लिखना था, I made mistake. ठीक है. So these are easy. These 2 numbers will be easy. Please don't let go hold of it. I request please जितना भी short forms है, make a PDF, make a small list out of it so that it will be easier for you to revise. One advice. Second advice, I had requested anyone if possible नहीं होगा तो मैं खुद ही करेगा. The instruments which I have shared till now, I think multiple 30-35 instruments, named instruments will be there. उसको please make a PDF so that every time you watch that list, that name, that image will come into your mind and it will like get stick on over there. Okay, similarly over here and and third advice will be I'll say 12 days are remaining. Okay, start making a list in which you write whatever topics you feel or find difficult to remember. Okay, why I'm saying these things is last 24 to 48 hours will be very stressful. You will be traveling to a new place, you will be going to a new college for giving your exam where you don't know anybody. Okay, so in that time what happens, last 24 hours nobody wants to study. Your mind will say हो गया, बंद कर दे, नहीं पढ़ूंगा. उस दिन क्या रिवाइज करना है? Those 10 topics which you have decided कि यार these are the 10 things I find difficult. So revise those topics for yourself. These are different for everybody. So there is no set कि भाई यही पढ़ना है. अपने हिसाब से you have to read it. So let's see these important short full forms. Nails का full form. Somebody would like to try?
Non-allergic rhinitis with eosinophilic syndrome.
Thank you, Dr. Saab. Non-allergic rhinitis with eosinophilic syndrome. Important question. Okay, this is important in itself. Yes. Now, EPOS, multiple number of times it has been shared. European position paper on rhinosinusitis and nasal polyp. This is very important. छोटा PDF I would have shared you 8-9 pages का है. Go through it. That flow charts, biological treatments in your CRS, it is important. This is one section जहाँ पे you can even skip Scott Brown. Scott Brown छोड़ के आप EPOS पढ़ के जाना. But अगर if you have not read EPOS, so then it is a problematic thing. Okay. So there is a brother of EPOS by the name of Euphoria. The full form is, I'll just write it, European Forum for research and education in allergy and airway. ठीक है? Now comes to this Carter-Jenner syndrome. What are the parts of Carter-Jenner? There is bronchiectasis, there is situs inversus, there is ciliary. ना एज़ोस्पर्मिया नहीं आएगा इसमें, ठीक है?
Okay, sir. Okay.
Remember it. This is a mistake. This is a very common mistake. Very common mistake. I also used to do it. Everybody does it. Azoospermia related something sperm, something young. So azoospermia जो है, this will be a part of young. Remember this, हाँ? ठीक है. अभी Carter-Jenner की बात कर रहे थे. Remember it. कार में there are 4 wheels. ठीक है. तो there are 4 parts over here. Bronchiectasis, situs inversus, ciliary dyskinesia, and then sinusitis. ठीक है? In your young syndrome, you will be having azoospermia plus sinopulmonary disease. Then comes the Samster-Strad, the easy one. What is it? Aspirin sensitivity,
sensitivity, allergy,
asthma and nasal polyp. ठीक है? And over here, please add 2 more full form. Area. I hope you remember what is area. बताओ.
Allergic rhinitis in asthma.
ठीक है. Read over it. Then second will be CB-NAT. Since this is my question, so I'll just write it. Cartridge-based acid amplification test. Okay, so these are important. Please read it. Okay, this is the logo for your EPOS, and this is your Young's operation that has been carried out over here. And this is the modified Young's operation. What is it? Young's operation में इसको पूरा seal कर दिया है. Modified Young's में what they have done. Why I put this over here? Because all the names should not confuse you. I have put it all together. ठीक है? Read about it. Where is it done? Where is it done? Okay, they have placed some hole for airway. ठीक है? Remember, read this Young's operation. This is different from Young syndrome. Purposefully I have kept it here so that you read it and not get confused in the end. ठीक है? Let's go ahead. This is we just saw. ठीक है? We just saw this thing. This is from your Dhingra only. Young syndrome, Carter-Jenner's. We just saw this thing. Okay. So this we had seen in recent advances. This is your image guided surgery or navigation. What will be asked over here is what are the indication. ठीक है? So remember the indications कि otology में these are the indications. Rhinology में frontal recess surgery, pituitary tumors, revision surgeries in places where landmarks are not palpable, there it is seen. Okay, so till now we have reached the midway of our session and now we will be landing up in the most important part. Most important मतलब सबसे important part from Rhinology. Like इसके ये पूछेंगे आपसे AFRS की बात. I'm talking about AFRS. So before landing up into AFRS, let's see about DeSalvo classification. He classified these things into 2 parts. One will be the non-invasive part and second was the invasive part. ठीक है? So mainly in the non-invasive, what do we get? We get the fungal ball, also called as the mycetoma, and second will be the AFRS. Very important. And in invasive, I'll not deal much detail into it. Read from one side. This is your mucor basically. Okay. So this can be acute, this can be chronic. So acute invasive rhinosinusitis, chronic rhinosinusitis. Okay. So let's see over here. This is one of the things that you have to 100% remember for your exam. Straightforward, they'll ask you what is Bent and Cohn's criteria. They might even ask what is the named criteria. That also they can ask. And they might even ask if describe it. 2 number का पूछ लेंगे. So इसमें there should not be any negotiation. Major criteria, minor criteria, cut. It should be there. Okay. So now coming over here for your AFRS, read whatever is there in your Scott Brown, whatever you have read from the notes. And I'd shared 2 articles with you. One was the AFRS का एक PDF था 4 पेज का, and another one was the pathology guidelines करके there was a link. In the pathology guidelines, they have shared the HPE images and the branching pattern for the AFRS. So please go through it. This is important. Please see both these images, this and this. Okay? Likely to be asked, already has been asked twice till now in last 4 years. Very highly repeatable question. Okay? Please remember the branching pattern for your aspergillus. Please remember the branching pattern for mucor. ठीक है. Second question which will be asked is, एक मिनट हाँ. ठीक. For AFRS, what is the appearance that is described as? Can somebody help me?
Axial grease appearance or butter
Yeah.
grease peanut butter.
Axial grease appearance or peanut butter appearance. ठीक है. Second question will be, what are the stains for AFRS? Somebody try.
Gomori methamine.
Yeah. Gomori, methamine, silver. I am writing in short form, but Dr. Saab, in your exam, please don't use short forms. ठीक है. Second, anything else?
Calcifurbide.
Calcifurbide. Anything else? Periodic acid shift stain. ठीक है. Pass हो गया. Now, what is the radiological sign that you see over here?
Tramtrack appearance.
Okay. Anything else? One more name.
Railroad appearance.
हाँ, रेलरोड हो गया. वही तो ट्रैम ट्रैक है. मतलब कुछ और इसके अलावा डबल डेंसिटी साइन.
Double density sign.
Yes. And second Viva question is waiting for you. Why is this double density sign seen?
Iron, calcium and magnesium.
Yes, है ना. So all these heavy metals, all these heavy metals, due to this deposition of this thing heavy metals, आपका ये sign देखा जाता है. Then comes the management. ठीक है. So over here you can answer both of the medical management, surgical management, and then your Viva will go into steroids के implications. और सर्जिकल में आपका फेस के ऊपर वाइवा चला जाएगा. सी गाइस, आई विल टेल यू, आर्ट ऑफ गिविंग वाइवा इज बेसिकली एन आर्ट, है ना. Nobody can like judge you what you have done in the entire 3 years in just 3-4 hours. Okay, so while giving viva, it's up to you. The steering is in your hand. It's up to you how you want to take the examiner. जो तुम बोलोगे, examiner will ask from the same things. ठीक है. He would have prepared 10-15 questions. I will ask these questions, and whatever you speak, उसके ऊपर your viva will start going. Like you'll speak over here AFRS पे, so he'll go on whatever possible questions can be asked from this place. Okay. Two things I would like to add over here. If they ask you what is the stain for aspergillus,
Fontana Mason.
it can be, you can either write Fontana Mason or you can write Papanicolaou stand. Whatever you want to pronounce, you can pronounce. I'm sorry for the writing. This is.
Sir, what is the first one, sir?
Fontana Mason stand. Fontana Mason. Read about it, both of them. ठीक है. This I saw today. I was checking what all further questions can be asked related to these things. So this I saw Papanicolaou stand. This remember. Fontana Mason, please check from your end. I'll also check from my side whether this is absolutely for aspergillus or not. Okay. So moving ahead, again rectification continues. What is Kupferberg staging? Please remember, important है. ठीक है. There is no point grilling you कि like इसको ऐसे ऐसे करना है. You have to remember. And over here in Philpott Zaveri, they'll ask you this question: what is the total?
100.
To remember the scoring. ठीक है. Same thing. They are just changing the names, making other things, and making the life of resident difficult. More things to learn. So please learn these things until your exam you pass. So remember the DNE or the endoscopic image of AFRS. ठीक है. वो that जो आपका peanut butter axial grease है, वो दिमाग you should that should run in your brain. Wherever you see that thing, so your mind should go towards aspergillus. Okay. This is the migrant position. They might ask you what's the name of this position. Okay. So now moving over here. So why I have placed this thing? This question came once, I think 2-3 sessions back. They were asking what identify. First thing is to identify, and then they were asking what is the sinus where it is most common and least common. Okay, so this is mucocele. Image is from Scott Brown. If you want, please go and read. From my side, please remember 3 points. How to identify. Most common होता है frontal
Signs.
and least में हो जाएगा sphenoid sinus.
Right.
Okay, so I don't want to bug you all much. Remember these 3 things. I'll move ahead. See, you इसका फोटो याद होगा जेंटलमैन का, है ना? So they can give you this image. इनका फोटो तो नहीं आएगा, but this scan का फोटो आपको they might give you. Okay, so remember it. Okay, now see this CT scan. ठीक है? I'll just enlarge it. I'll show you the details. So this is how the question will be asked. They'll give you some stupid history, and this kind of scan will be placed in front of you, and then some difficult answers will be asked for you. So this is from the chapter of fibrous dysplasia. ठीक है? Fibrous dysplasia was my long answer question, and I didn't know what to write. I just remembered there's something called as monostotic, polyostotic, and something cherubism. अभी what if cherubism कुछ नहीं आता था. Says it was like full pale. ठीक है? So please remember it. I'll just simplify it for you guys. Fibrous dysplasia. First thing is that it is an autosomal dominant disorder. Guys, third task for you. Please make a small list. What all possible things in our course are autosomal dominant. What are also autosomal recessive. Around 8 to 10 syndromes we have discussed. We'll revise it again. Include them in your list. What are dominant, what are recessive. Now, the mutation takes place in this gene, SH3BP2. And there are 3 types. This is monoostotic, that is in one bone, polyostotic, more than one, and third will be cherubism. Okay, let's see what all these things are. See, this is the
Sir, what is third one? What is third one?
Cherubism. CHERUBISM. ठीक है? Please read about it.
What is McCune-Albright syndrome? It is associated with fibrous dysplasia.
Yeah. बिल्कुल है ना? You have just mentioned it. Let me write it over here. ठीक है? So all your questions please place in one place only. एक जगह पे रखना है and read over it. So this is the image from where cherubism name is taken. ठीक है? And this is the CT image. Like these kind of deposition can be asked. Now after AFRS, this is the second most important thing that will be asked to you. Definitely it will be asked. Frontal recess. What are the boundaries of frontal recess? जैसे ऑटोलॉजी में I keep on pushing you guys कि भाई sinus tympani, facial recess, Prozac space. These boundaries should be learnt by heart. You will start your otology viva. He will ask you the spread of cholesteatoma, and you have to start from Prozac space. And if you falter in that Prozac space, नहीं पता होगा, your viva will not reach 70%, 80% of the marks. Here it will float around 50% of the marks. So remember, art of giving viva. Please, these are the questions that you should anticipate. The examiner is gonna ask me. He asked these questions, and you should hit a 6 on that ball. तो छोड़ना नहीं है इस क्वेश्चन को. तो ऐसे ही फ्रंटल रिसेस एंटिसिपेट, ये क्वेश्चन आता है फुल 4 नंबर लेके आना है इसमें. So what are the boundaries for frontal recess? This is something anterior, there is something posterior, something medial, and something lateral. ठीक है? So what is the anterior boundary?
Agar nasai.
What is the posterior boundary? Bulla. ठीक है? Medial boundary?
Middle turbinate.
And lateral boundary? Lamina papyracea. And now for people like me, like people who don't understand much, है ना? See this: anterior agar nasai, medial turbinate, lateral lamina papyracea. ठीक है? Over here, please remember जो अभी list हम लोगों ने add करी थी, named cells है, उसमें सारे named cells you have to revise, and draft procedure. Okay, I'll be sharing the OSCEs related to draft, but please read about 1, 2, all these things over here. And I'll share an incident which happened with me during the residency days. These were the first year चल रहा था, and hardly it was first month, second month, something was there. I was third, like faculty was operating, third year was helping, second year was on table. I was first year, I was like पीछे खड़े होके देख रहे हैं चुपचाप. So one of the faculty just came near me and he was like, yes, what is bulla? And I was like literally first second month में bulla is like, मेरे को तो movie वाला bulla याद आ रहा था. I was like just kept my mouth shut. Otherwise, like what all things could have gone wrong. So remember, posterior is bulla. Baki all you can just correlate and answer. It is important. Okay. So this is the CT image of the same thing. Please go through it. This is the normal frontal recess anatomy. They'll ask you what is this dotted arrow, what is this white arrow, what is this black arrow. So I've mentioned it over here. please go through it, or this is the application of the knowledge which you have seen above. Okay, so moving ahead with time, again similar thing, boundaries of end bridge, frontal recess, which we saw earlier. Okay, let's go to the third thing. Third important thing is your complication of CRS. जैसे otology में complications are important, similarly complications of CRS are also very important. What is the name of this classification? This goes by the name of Chandler. ठीक है? So what all questions can come? Definitely they can ask you to I'm sorry. Like to describe it, so you should have to tell it all: orbital, intracranial, bony and chronic, and they might ask you what is the most commonest, तो आपको ये बताना है, and what is the most commonest in intracranial में subdural empyema बताना है, ठीक है? What all questions can come? See, this is also a question which can be asked. So this image is from Scott itself, ठीक है? So they'll ask you that so and so patient came with complaints of proptosis and discharge and flow, and this is the CT scan of the image. What is the positive finding? And then your viva or oblique OSCEs में multiple questions will come from this. Now, second में आपका Pott's puffy tumor. Pott's puffy tumor will see mucocele का OSCE and image we have already seen. Pott's puffy tumor में this is the image from Scott Brown. Okay, so remember this thing. This is a complication from CRS, and so all the complications we have seen one image. Mucocele का देख लिया. What is the most common, least common? Pott's puffy tumor देख लिया, and intracranial and orbital का CT image देख लिया. Now coming to this thing, repeated question, ठीक है? Important, repeated but important, ठीक? So what is the, coming to this thing, remember the trade name also, Xolair and Bolstron. What is the mechanism of action of your omalizumab?
Anti-IgE.
Anti-IgE, ठीक है? Dose you also remember. Indication में you have to write your asthma, severe refractory, allergic rhinitis, all those things you have to mention. Oh, this is important. Coming to brother of omalizumab, this is dupilumab, ठीक है? So dupilumab basically this is, हाँ बताइए?
IL-4 inhibitor.
Yeah, Dr. Sahab, you have learnt it all. Very good. So this is inhibitor of IL-4 and IL-13. 4-13 dupilumab. Where is it used? This is used in CRS plus nasal polyp में. This is used in asthma. This is used in atopic dermatitis. What one funny thing they usually ask, they'll ask you give one use in ENT, one use in non-ENT. So you have to remember one use, something like this also. ठीक है? So I'll still need 10-15 minutes more to finish today's session. Can somebody try? What kind of sign is being shown to you?
Holman Miller.
हाँ,
Brown.
Yes, Dr. Sahab. Okay, so we'll be seeing these signs in the GNA. These are important. So this is your Holman-Miller sign. We have mentioned it here. This is the Holman-Miller sign. Image is from your Radiopedia. Okay, this is basically the. They will ask you to describe it. So this is your bowing, anterior bowing. Okay, remember it. Okay, so coming ahead, these two more signs are there: Ramaran sign and chopstick sign, Holman-Miller sign and Hondusa sign. है ना? So please remember it. This will be asked. This might be asked to you in Viva also. This might be asked to you in the similar OSCE दे करके भी पूछ सकते हैं. Tell me what is the finding. Okay, again this image is from Scott Brown. Okay, so they are telling you the endoscopic image and the MR of the GNA. Apart from this, you have to remember the theories of GNA. Like you have learned the theories of cholesteatoma, there are multiple theories of GNA. So remembering anyone, one or two name?
Ringer's
theory, Schick theory.
Ringer's theory.
Most accepted one is
Hematoma. This is the brachial arch theory.
Schwartz theory. Then there is something fetal erectile. Multiple type theory will be there. Fetal erectile. है ना? So after theory you have to remember the spread. After spread you have to remember the staging. Multiple staging are there. ठीक है? Remember any two. है ना? Either you remember Andrew's fish, either you remember Redkowski, anything, anyone you can remember. ठीक है? There's no one की saying कि everyone remember everything, but at least one you should remember by heart. It should not happen कि you have gone to learn everything and not learn even single thing. वो नहीं होना चाहिए. And fourth thing, management. ठीक है? तो इसमें embolization, please read about it.
this is the Rhinology staging. I'll not bore you by reading into इसके अंदर क्या है. Please read it. This you have to learn. Any one you have to learn. Decide whatever you want to learn. Please learn it. And this is your phase classification. ठीक है. Now, what is the name of this phases which they say? This is called as frog phases. This is seen in GNA. ठीक है. This is the brachial arch theory that we were seeing a while ago. Okay, let's move ahead. Sorry, it's becoming too tiring, है ना? Chalo. This is only few off keys are left. Just little bit of time. Just maximum 10 minutes. ठीक है. Now, what is the full form of UPSIT? What are the contents? What are the advantage? Can somebody help me in answering?
University of
University of Pennsylvania
Smell
smell
identification
identification
test.
Great. It is correct. Absolutely correct. It consists of 10 to 15 cards. Okay, and they have a small pencil also to scratch. I'll visualize it like इसको देखियो आप. ठीक है. Now again I'll share you my personal experience how the Viva can go wrong. ठीक है. He at the full form, if this many cards are there, we scratch it and in very less time we get the result. Now what question he asked me? He asked me, how will you scratch those cards? I was like, okay, I don't know. Then he walked me, will you scratch with your fingers? Will you scratch with all those things? So then I came to know that bhaiya, pencil is there in this kit with which you scratch it. Okay, so this is important. UPSIT, please remember it. After you read UPSIT, second question which can come from here is rhinomanometry. ठीक है? Okay, now they are asking you what is the identify this thing and what is Jessner solution, what is used. So Dr. Sahab, this is electrical dermabrasion machine. ठीक है? Electrical dermabrasion machine. Don't write cobbleter for it. ठीक है? It's looking something like cobbleter. ठीक है? This is Jessner solution over here. Just remember the name. Why is it used? This is used for peeling purpose. ठीक है? Now I think we have landed up in the last question for today. Okay,
sir,
so
where is this where is the electrical dermabrasion used, sir?
There was cosmetic purpose, cosmetology.
Okay, sir.
ठीक है? For peeling और वो derma के लिए ना, derma rolling के लिए they will be using it. ठीक है? Images from Scott itself. This I've not taken from anywhere else. So since it was there, so I included it. ठीक है? If you want, just Google it, so you'll get few more details on it. इससे ज़्यादा I don't think they'll ask you. ठीक है? If you are still more interested, please एक बार पढ़ना है. ठीक है? So now coming to this last image for today, they are asking you identify the disease, and then they are asking you what is Trotter's triad. So can somebody take a try?
Carcinoma.
Yes, doctor. Yes, doctor. This is nasopharyngeal carcinoma. This is very important for you after CA maxilla. This can be one of the short case that can be kept if it is available. Okay, so make up your mind to take this thing as a short case. So when you will take it as a short case, so all these things will come. Ipsilateral conductive hearing loss will be there. Sorry. Ipsilateral palatal palsy. This is due to involvement of 10th nerve, and then there will be facial pain. Okay, and this is NPC. Now, जो आपका Trotter syndrome में we already saw that these three things are composing of your Trotter's triad seen in your nasopharyngeal carcinoma. Okay, so over here, please, there are few important points. Just last 5 minutes. I'm sorry for extending it. Etiology, EBV, please remember it. Okay, there are multiple other things. Please remember it. Okay, so you have to answer the genetic format. That this is HLA2 dependent. Then some environmental factor. Then you have to go for the China salted sea fish, and there's a province called as Guangdong. Okay, it's also called as Guangdong tumor. And then viral. These three are the etiology. Okay. Then please read about the spread. Second, staging, in which apart from the TNM, there is something called as post staging. And over in the NPC, there is one more specific question that can be asked to you. TNM में जो N है,
This is important. And then comes the management. So this tumor is highly radiosensitive. It is said that it responds very nicely to the radiation treatment. Okay, so Dr. Saab, apart from this, there are few OSCEs which will be there. With these, I'll share on the group itself. Okay, and okay, so the remaining OSCEs I'll share in group. General OSCE, हाँ बताइए.
Sir, if the presentation is over, so I can ask another question.
Please. Right?
Sir, how many cases will be like? How many cases we have to present? Like two cases only, or two short case or one long case like that?
See, I'll tell you what as comes in your जो आपका DNB का जो notification है, there they are saying कि there are two cases, ठीक है?
Yes, sir.
50 and 50. So be rest assured कि generally you will be given two cases आते हैं, दो cases आएंगे. And in few places what happens कि अगर आपको short case नहीं मिल रहा है तो they might give you a single long case also for 100 marks.
Okay.
This is also a possibility. But mentally makeup इस तरीके से रखिएगा कि you have to take one long case and one short case.
And so both long case 50 marks, right, sir?
Ideally yes, but you also think technically it is wrong. Long case or short case, agar both of them are being asked for 50 marks, so it's little bit biased, I'll say. But still, as the notification goes, this is what is being told. Okay, so you have to prepare accordingly. And short case may they'll give you 10 minutes. Okay, so please mention the important positive points at least in your history. And what I'll suggest is कि always try to make a list what all cases can come. Like if a long case, I'll help you out. This is the Seum squamous. I'll say 90% of you will get it. Most of you will get it. Apart from that, there can be a thyroid case. There can be a CA oral cavity. There can be either I'll not try to frighten you guys, but CA hypopharynx or larynx, they might keep you if you are very unlucky, or CA maxilla. Okay. Similarly, short cases we had already discussed. They can keep CRS with polyp. They can keep GNA. They can keep inverted papilloma. They can keep vocal cord polyp or something like that. Okay. Or apart from that, they might even keep something like thyroid also. Thyroid agar long case nahi hai, so they might keep it as thyroid, like short case also. So that's why reading thyroid is very important. It always helps you out.
So what about parotid? So parotid will they keep?
They can keep. If they have, they can keep it. But it will be short case only. So short case mein you don't have to worry much. Short case mein you just see. Most probably you will be able to, like, if you are lucky, this you will come to know 2 days or 3 days prior. Most of you, like, who are lucky, they might come to know what cases are being kept in the exam. Okay, so don't worry about that. But supposedly if you get parotid also, just take random 2 minutes के बात कर रहा हूँ. So don't have to worry too much. He said this much year old male came with complaints of so and so swelling on this side of the tongue. उसका insidious host आपने बता दिया. And always any viva which you are undertaking, remember अपने दिमाग में एक बार just go through what are the possible DDs. And what are the DDs will be there. The examiner will ask you questions based on that. So you are saying it is probably Warden's tumor. Why are you saying it is Warden's? Or supposedly if you are saying this is malignant, why are you saying it is malignant? You're getting my point. So according to it, you have to frame the history. It shouldn't be ekdam, you are blatant ekdam bol rahe ho, it is unilateral, female hai, and then you are sir it is Warden's. So you chad jayega कि भैया male 10% rule bilateral smokers में more common, and you are saying just the opposite. So these are the things that you have to keep in your mind. Okay, so make a short list of that thing, post it in the group. People keep it editable. Let people edit it also. Okay, and according to it, it will be there. Any other thing, right?
Sir, can you tell us about counseling the patient?
Yeah, it will be there. Counseling, I have noted it down. Counseling में आपको I'll update you. Don't worry. ठीक है, how to go about counseling.
But we are not well versed with indirect laryngoscopy, and we are not.
करता है, हर कोई DNE करता है, ठीक है. But please learn how to use it. ठीक है. Nobody will be interested, है ना? Learn how to use it. Findings में जो भी, like whatever you are able to appreciate, write that thing. Nothing apart from that. Counseling is on me. I'll share it, and in the next session we'll start with the counseling only, because I want to dedicate 5-10 minutes like specifically for counseling. Okay. Any other point from your side? ठीक है ना? Because I just don't want to like pass on this question. Counseling is important. They might ask you that they might ask this counseling thing in the ward round also. They might keep a patient and they'll ask you how will you counsel him for surgery. So there also it's important, and they can even place a station for it also. ठीक है? Station मतलब OSCE का station. ठीक है? Sure. Anything else from your side? If nothing, so you can drop me a message also. Any doubts from like